Well, the answer to that big question of precision is something called anatomical planes. You can just think of them as a universal coordinate system for the human body. It's a language that every single medical professional on the entire planet understands.
Okay, the most important word on this slide is imaginary. These planes aren't actual things inside you. Nope, they're conceptual tools, these imaginary flat surfaces that we pretend are passing right through the body. And this all works from a standard starting point, the body standing upright with palms facing forward.
All right, let's start with our first major plane. I want you to imagine a giant sheet of glass dropping vertically through your body, splitting you right down the middle from front to back. That feeling, that visual, that's the sagittal plane.
And here's the core idea of the sagittal plane. It's that vertical cut, and its only job is to create a division between the right side of the body and the left side. So, here's the main takeaway. If you hear sagittal, you should immediately think right and left.
Now there is a little extra detail here. If that slice goes perfectly down the midline, I'm talking right through your nose, your belly button, creating two equal halves, we call that the median or mid-sagittal plane. Any other sagittal slice that's off-center, creating unequal right and left parts, is called parasagittal. Simple as that.
You know what? You've definitely seen this before, probably without even realizing it. That classic side view of a brain in an MRI scan where you see all the structures from the front to the back? Yep, that's a perfect example of a sagittal view in action.
Okay, so we've got right and left covered. Let's move on to our next plane. Instead of dividing right and left, this one slices the body in a completely different direction. This is the coronal, which is also sometimes called the frontal plane.
So the coronal plane is also vertical, but it runs side to side, which basically splits the body into a front half, what doctors call the anterior, and a back half, the posterior. So the big takeaway here? Coronal always means front and back.
And here's another real-world example you'll recognize. You know when you stand in front of that big machine for a chest x-ray? The picture it produces is a coronal view. It's showing your lungs, your heart, and your ribs as if you were looking at them from the front.
Okay, we've divided the body right from left and front from back. So what's the only direction left? You got it, dividing the top from the bottom. And for that, we have our third and final primary plane, the transverse or axial plane.
So, unlike the other two planes, this one is horizontal. It cuts straight across the body, kind of like a tabletop. This creates a superior or upper part and an inferior or lower part. So when you see transverse, or its other common name, axial, you should immediately think upper and lower. And this is absolutely huge in modern medicine. CT scans work by taking a whole series of these transverse slices. A radiologist can then scroll through them, almost like they're flipping through the pages of a book, to get an incredibly detailed, cross-sectional view of everything inside.
So we've got our three main players, sagittal, coronal, and transverse. But what if a cut isn't perfectly vertical or horizontal? What if it's diagonal? Well, for any of those angled slices, we have a simple catch-all category, the oblique plane. It's basically any angle that doesn't fit into the other three boxes.
Okay, we've covered a lot of ground. We've got our three main planes plus our one extra. So just to make sure this all really sinks in, let's do a super quick review. Let's just break it down one last time. Sagittal cuts, those create right and left parts. Coronal or frontal, that gives you a front and a back. Transverse or axial splits the body into upper and lower sections. And oblique, that's just any other weird angle. See? Not so bad.
And hey, if you want an even faster way to lock this in, here's a fantastic little memory trick. Just think sagittal for side to side, coronal for your chest or that front view, transverse for top to bottom, and oblique for a slant. That's a great little tool for studying or just remembering. All right, so all of this talk about imaginary slices might seem a little abstract, I get it. But it is so incredibly practical. Let's talk about why this isn't just some boring textbook stuff, but why it's a flat-out clinical necessity. Seriously, from the radiology department to the operating room, these planes are the universal language of medicine. Radiologists use them to read every single CT and MRI scan. Surgeons depend on them to know exactly where a tumor is. And for students and nurses, it's the basic grammar you need to write accurate notes and communicate effectively. This is where the rubber meets the road.
And when you get right down to it, that entire world of medical imaging and communication, it all boils down to this one simple number: 3. Just 3 primary planes: sagittal, coronal, and transverse. They form the absolute bedrock of how we see, understand, and talk about the inside of the human body. And this slide really says it all. If anatomy is a language, then these planes are its fundamental grammar. Once you master them, you can fluently read the complex story that the human body is always telling.
And that leaves us with one final fascinating thought. For centuries, we've relied on these three foundational planes. But as our technology gets crazier and crazier with things like 3D and even 4D imaging, will we eventually need new planes or maybe a totally new system to map the human body of the future?